Good morning, Namaste. I'm Dr. Manish. Today I'm going to discuss one very important case with you. It's a case of postpartum eclampsia with us. And this lady came to us after the elective cesarean. She had a GTCS beforehand. The unfortunate part was that this patient was having endobronchial intubation. Now, because of the endobronchial intubation, which is a known complication which happens with any patient who is going to receive endotracheal tube-based therapy, right? And if you can see this X-ray, so you can see that the complete left side of the lung is not visible because it was a right main stem endobronchial intubation. So the right lung is hyperinflated and the left lung was hypoventilated. Whenever you have this situation, obviously the first therapy is what? You withdraw the tube, make sure that you are having a bilateral air entry which is equal. But despite of doing all these therapies, you still may find that if this insult of endobronchial intubation continues to be there for a good period of time, then despite of doing the corrective measures like withdrawing the tube and putting the tip of the tube in the mid-carina, the patient can still continue to have a collapse of the segments which were affected. Now, when you have this situation, you obviously try conservative therapy, you start bronchodilators, mucolytics, making the non-dominant segment of the lung, the affected part of the lungs has to be in a non-dominant position and the healthy lung has to become dependent or the dominant. So you do all this kind of lateral ventilation strategies and mucolytics therapies, but you still find that despite of doing all this conservative, the batch of treatment, the patient may still continues to have the collapse. Now, if you see the today's X-ray, can you show? If you see the today's X-ray, so you can still see that there is a significant collapse of the left lower lobe of the lung, right? This is despite of taking care of that the tube is now into the mid-carina position. So when you have this situation, we do a quick diagnostic bronchoscopy. Also, you put them lavage, the saline-based lavage, the mucolytic therapy, just to ensure that, in case of the patient, segments of the lungs, they are not getting ventilated because of iatrogenic reasons or because of mucus plugs, you can dissolve them and you can improve the patency of the airway. When you do this exercise, obviously this exercise is a high-risk exercise. High risk means when you're doing a procedure, the patient can desaturate, they can show arrhythmias, they can have accelerated hypertension, hypertensive emergency can happen. So you need to have a complete team with yourself. As I have shared with you a couple of times, multiple times, we have a dedicated bronchoscopy team with us. In order to perform this scopy, one person has to scoop the patient. In this case, I'm taking a liberty to do the bronchoscopy, but then we have Dr. Ankit with us, who is going to help us in maintaining the airway whenever we are doing a bronchoscopy, especially in a physiologically challenging airway, which means the patient who has a tendency for desaturation or airway collapse. You need to have a trained operator available with you to escort the complete exercise. And obviously, when we are doing this drill, you also need a good technical staff. So Mr. Ansari is the person who is going to help us because he understands that what we need. So you have to tell them beforehand that what exactly and how exactly your patient is going to behave, is likely to behave during the procedure. Then we have Ms. Asha, who is nursing in charge with us, and we have the young enthusiastic anesthesiologist with us. Dr. Akhilesh is there. Dr. Shafani, say hello at least. Dr. Akhilesh, Dr. Shafani, and Dr. Prameet. So they are the young budding airway expert managers, because they are soon, they will be on this side and maybe we are going to be on that side. So we are wishing that they are going to help us in doing this mission of airway bronchoscopy. So now I will show you that what exactly the findings which I have been able to elucidate in this case, right? There in the tube. Now this, you can see the marker, the blue line, it belongs to the tube, right? This is a radio opaque line, right? Now can you see that tracheal stem looks red and it looks like inflamed? This can have happened. Now this is your carinal spurt. This is your carinal spurt, right? And this is at 9 o'clock position. This is your left main stem, right? Into next, please. So can you see this mucus plug? This is a mucus plug. Now this mucus plug which we were thinking, right? So there is a big mucus plug. So काफी बड़ा है.
आगे 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 सर आगे 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 आगे
थ्रोट ना
Oh my God.
बस वेंटिलेट करो वेंटिलेट इज इट सीन
Yes, sir.
ओके ओके थैंक यू चलिए
टेन एक्स्ट्रा
हाँ
सर सर
दिस इज राइट अपर लोब ये वाला जो है ना
हाँ ये
पिक्चर